Welcome back. This is TV47 Breakfast Show, and the hashtag is TV47 Breakfast Show on Twitter and on Facebook as well. Emmanuel Terrell is on standby to take your questions, so speak to us also on our TV47KE on Twitter and on Facebook as well. Let us go through some of the questions that currently are in the public limelight concerning COVID-19 or coronavirus. How does it spread? How do we reduce the chances? How are the symptoms seen and separated from common flu? And now it's just coming out in the public as well. Some of the myths that is thrown around in form of information. Emmanuel Terrell, what are people saying on Twitter concerning COVID-19?
Watu ambao wanazungumza wengi wao aswa kuna moja anaitwa at 0_Bruce anasema Jack Ma donating or giving back to the world, at Jeff Bezos donating our own so-called wealthy, at C. Kirubi, at Kenyatta family, at Gideon Moy, at Raila Odinga can't even spare a cent. Instead they will register ACO selling sanitizers and tissues. That's hiyo ni kwake anazungumzia vile vile. At H. Nyakio anasema stay safe everyone. Una ujumbe wake bila shaka anazungumzia. Nataka kupitia ujumbe kuambia watu kwamba wakae ange. Moja anaitwa at Godi Kasela. I'm self-quarantining myself here. I sneeze a lot and I have difficulty in breathing. Does it meet a test case? I guess ndolo swali ndolo taanza nalo Corazon anauliza huyo bingo. Vile vile okay, napenda kitu kimoja, hata kama ni hatari vipi wao watatafuta nafasi ya kuchekesha. Kuna moja anasema at Ngala Junior, heri miadarati hii at #COVID-19 KE inaleta na joto mingi akilini. So nafikiria then kuna moja kabla nikupatie at Nahashon87, I got in the bus almost half empty today. Sat next to someone probably in his late 30s. He kept his eyes gazed outside the window and he held his hands together. Nothing alarming. Then he sneezed, revealing the handkerchief his hands held. I didn't wait for a whistle. #COVID-19 KE kumaanisha kwamba katika magari yetu sasa hivi asubuhi na nikisikiza jana wale wahakiki wakubwa wa madaktari kusema ukweli wanasema kwamba heri kutumia shashi makaratasi shashi tissue kuliko handkerchief.
All right. Thank you very much, Emmanuel Terrell. I'm sure that Dr. Brenda Nyaradio is going to start with that question. Dr. Brenda Ruth, karibu sana. I know that there's a lot happening along the streets and in the hospitals, by the way. How is the situation so far?
So far, we are just putting measures in place.
All right.
We are triaging differently. So we are screening just the way the temperature screens are happening all over. Before patients get into the hospital, just for precautionary measures.
All right.
Yeah, so if we have suspect cases, then we have a room specific.
One question we asked ourselves yesterday is we kind of are sympathizing with health practitioners right now because it looks like not so many people would easily tell the difference between the symptoms of a common cold or flu and the symptoms of coronavirus. And that is one of the questions that have been flaunted by the viewer from Twitter. How easy is it? I mean, what are the differences? Can you isolate one or two symptoms that are here and not in the other case?
Well, it's very difficult, as you've said, because they're extremely similar. The common flus and this coronavirus. Though for the coronavirus, you'd have pneumonia-like symptoms. Pneumonia just meaning infection of the lung. And you'll also have difficulty in breathing, which is not so common in the normal flu, as well as shortness of breath. So you have that shortness of breath, the difficulty breathing, and then this fever that really doesn't go down. And what we say is malaria-like symptoms. So you'll have it worse with coronavirus, which is not so common.
At what point will someone begin having the shortness of breath? Because I'm assuming probably it's the one symptom that stands out more when you compare flu and this virus.
Okay, this is very, what do I say? It's not specific,
right,
but it depends on the individual. if you have underlying conditions, your age group. So it's anything between 2 to 10 days. And not everyone develops shortness of breath. So there are those who get coronavirus who are just simply have the normal flu-like symptoms, and it ends up resolving.
Normal meaning you just have a
runny nose, you have
headache.
the sore throat, you have the cough, you have the misuli,
right, or the aching muscles,
yeah.
So basically, does it mean that anyone who has flu-like symptoms should visit a physician?
Not everyone with flu-like symptoms.
Right.
If there are flu-like symptoms which you can manage at home, then you're better off self-quarantine, although it would be good to get in touch with a hospital or a healthcare practitioner to advise you better.
All right. The picture in the hospital right now, does it mean that everyone who walks in is handled as a suspect case, and now our health practitioners basically have to have their gears on? How would you be able to tell that the person who's walking in and seated across is a suspect victim or not? Just from participants?
Well, as I said, from the triage, we try to identify. We are triaging first for the fever.
Yeah.
So anyone with a fever and is presenting with flu-like symptoms, that's a highly suspicious case, which we'd definitely put aside and provide a mask for them. We put in a different isolation room so that they don't mix with the rest of the patients. And the doctor attending to that patient is also geared or has that prior knowledge.
Right.
Yeah.
So meaning the protective gear, the protection of the doctor begins from the triage, because the triage personnel probably is the one who handles every case that walks in.
Yes.
All right. You've spoken about aching muscles and headache and malaria-like and flu-like and all that. Is there any other, knowing that we have been informed that it spreads from the hand to any other opening in the face, is there any other symptoms that have been left out that people should watch out for?
Any other symptoms?
Right.
Well, other than the normal flu-like and probably the ones that would now be a sign of severe disease, like now the difficulty breathing, the failure of systems, which will definitely, that will be a patient who's who needs medical attention or needs to be in a hospital setup.
Right.
So far, still it's under study. It's a new virus, so we are still trying to explore it further and define it.
All right.
Yeah.
So far, do we have a definite period or approximated period between the time someone becomes asymptomatic and the time of extreme or severe attack, where now we are talking about failure of body organs?
No, there's no period. Though presentation of symptoms is any time between, from infection to presentation of symptoms, is any time between 2 to 10 days.
Okay.
Yeah.
All right. Spreading of the virus. There are two things with the public right now. That when someone who is infected sneezes or coughs, you get it. And that makes people assume that it is airborne. The other information is that it is not airborne, that apparently the organisms have to land and be picked by the hands and then transferred into the opening, into the body through the openings. What is the really exact mode of transmission? How is it transmitted from one person to another?
So transmission from person to person is mainly via droplets and close contact. So close contact means you'll be exposed to the droplets. When I speak, even as I speak now, there are droplets in the air that. So if you're within 6 feet of contact, that's what we define as close contact, then you're likely to get infected if I'm infected. Yeah. So close contact. So close contact just means those droplets will reach you.
In one way or another.
Yes.
And does this mean that chances are there when people board a matatu or people are in the same room when one or two are infected, even with this hand sanitizers and all?
Yes, that's probable.
Right.
Because if we have close contact, you don't sanitize your face. When we talk, there are those people who...
Yeah, they talk and the droplets happen.
Yes. And when you speak about the public transport, there's also another probable form of contamination is you're holding the bars along the aisles, you're holding the doors as you come in. And of course, in that setup, you're not washing hands and you're not, it's very hard to try to maintain disinfection in such a state.
What is then the foundation of hand sanitizing with these droplets and still with the chances of droplets passing from one person to another just through
So other
means?
than proper hand sanitizing and proper hand washing, not just sanitizing, because there are those people who don't have access to sanitizer.
Right.
So long as you have your soap and clean water, it's equivalent to sanitizer.
Right.
So other than that, it's usually combined effort. It's not just the sanitizing, but you also have to employ proper hygiene when it comes to when you're sneezing. If you're having a sneeze or a cough, use whatever you have, cover your mouth so that now you limit the droplets in the air and contact. So it also has to do with proper respiratory hygiene.
Actually, I know now this might not be your docket. This is some probably policymakers and all. But would then this not raise concern when we still don't have proper surveillance of who exactly is infected and they're still boarding public transport and they're still interacting with the public? If a simple cough and a sneeze, even with hand sanitizers, would still guarantee an infection?
Not necessarily guarantee,
Right.
though that's the challenge when it comes to especially a new virus, and then the incubation period is pretty long.
Right.
So it's a really sneaky virus in that it's not the type that if I get infected today, I'll manifest today and you'll be able to catch me and quarantine me. It's patapotea, so to speak. So I have to self-quarantine for at least 14 days to see, okay, am I having symptoms if I was exposed? So that's the challenge. The challenge is actually the incubation period of this particular virus as opposed to the measures we take.
Okay.
Yeah.
This simply means, Dr. Brenda, that probably a total lockdown and quarantine, self-quarantine for everyone would be the only solution. That would be the best solution
Yes.
for people to remain at home.
Usually self-quarantine it's good in containing disease, especially in cases of now this is a pandemic. Self-quarantine is one of the best ways to contain.
Right.
Yeah.
Just don't go outside. But then there's actually so many challenges with that.
Avoid crowds.
Avoid crowds. And how do you avoid crowds when you have to survive? Thank you very much for staying with us as we continue this discussion. You have a chance to ask your questions concerning COVID-19. What are the questions that you have concerning coronavirus that is now a global pandemic? There's so much information out there, but we have an expert, Dr. Brenda, in the studio right now to take on all the questions that you have. I know Emmanuel Terrere is preparing to tell us what's on Twitter and what other people have been asking or saying about this on Twitter, but you can call in live or send an SMS 22047 or RTV47KE on Twitter as well as Facebook, and then your questions will be answered promptly. Management of this, there are very many other things that have been said, that you can gargle hot water so that the virus apparently the organism stays in the throat for 4 days, as other people have said, that if you gargle hot water, you will be able to kill it. I mean,
First of all, if you gargle cold water,
Hot
you're going
water.
Oh, sorry.
Hot
if you
water,
gargle
yeah.
hot water, you're going to cause injury to your tract.
right.
So that's a no-no. Corona, I mean, your body temperature, as much as you'll gargle hot water, you won't be able to gargle hot water throughout 24 hours for however many days. You said it stays in the throat for 4 days.
Is that true, first of all, that the organism stays in the throat for 4 days, and if you gargle hot water, it might kill it, or if you swallow the water, it will take it to the stomach, which has acid, and then it dies?
No, that's a myth.
That's it. And how about that if you shower with hot water, you will have killed the organism that you picked from anywhere?
As much as you shower with hot water, your body temperature is maintained at a certain temperature of,
Right.
let's say, about 36, 37. So it won't go beyond that. As much as you scald yourself and burn, you'll just burn your skin, but your body temperature will remain the same.
That coastal region has high temperatures, and that simply means the virus might not survive.
No, but the virus, we're seeing it in Iran and other really hot places.
And that elderly people are the ones that might get affected faster because their immunity system is lower, and so the younger people should not be very afraid. Is that a myth or a fact?
It's a myth because everyone gets infected. Everyone may get infected, but it's just that in the elderly, whose immunity maybe is a bit compromised, it tends to take a more severe turn, as opposed to, because we say 20% get really sick, then 80% get that normal flu-like, and they're fine.
So the younger people just have a better immunity. That's the only difference?
Yes.
That hand sanitizers with a higher alcohol content are more effective than soap and water hand wash.
No. Hand sanitizers, okay. The alcohol, so long as the alcohol content is above 60%, then that should do it. It doesn't matter, even hand washing for 20 seconds and alcohol rub of 80%, it would serve the same purpose.
So if you can wash your hands using soap and water,
running
water,
running water,
that would still be effective.
Yes.
All right. That we should not touch any openings in our faces for as long as this virus is still with us, because apparently we can lift it into our body.
So we just have to practice really good hand hygiene and regular hand washing or alcohol rub practices. But limiting contact with our faces and our hands when we've not really cleaned our hands. Like if I'm doing work and I hold my pen and I'm seeing a patient, then I scratch my face or touch something on my face, then I risk infection. But if I see my patient, wash my hands, then touch my face,
you're still all right. So hand hygiene is the
the
whole
key.
point.
Yeah.
All right. We have seen people buy so much tissue paper, and our question that is now with us is, what is tissue paper for, one, and in case this finds 1 or 2 or 3 people who have to self-quarantine, do we already know the best ways to manage the anxiety or any other issues that might come with self-quarantine?
Wow, you've asked me 2 questions.
Yes, I have asked.
First of all, the purpose of the tissue.
Yes.
I actually don't know why Kenyans are buying tissue.
Apparently because there'll be a lot of running noise and you cannot use hankies or something you can wash. Then you have to dump it. I mean,
if anything, I think other than, because what I've seen on social media is rolls and rolls of tissue.
Yes.
So as opposed to toilet paper, there are tissue boxes that I've seen people are not buying that.
Right.
And they tend to be of, their production is different degrees. So toilet paper tends to have more dust and more...
Which is risky.
Which is still not hygienic and would make your respiratory symptoms worse. And your second question was
management in quarantine, just in case 1 or 2, just in case we get to a point where we have cases that have to self-quarantine. Do we have particular measures already that somebody should know about if they have to self-quarantine?
So self-quarantine basically just means you staying at home, one. If you live alone, that's better. You can actually self-quarantine quite effectively. But if you live with other people, you try to get a room separate from the rest of the household. Try to, if there's an extra bathroom, have your own isolated bathroom. Then when it comes to utensils, you need to have your own designated utensils that you wash thoroughly after use. And within that sick room of yours, you should try to have surface decontamination. Try to clean the surfaces regularly so that also you don't expose your caregivers.
All right.
Yeah.
How about masks? We have had conversations that this mask is more effective, this one is not effective. The one apparently that is mentioned as N95 or something is rare and it's expensive, and if you have not been infected, there is no need for a mask. What is the whole thing about masks?
So the guidelines right now for use of masks is basically for those who are infected to always put on a mask. Then if you're not infected and you're attending to someone who is infected or has flu-like symptoms, you also need to put on a mask. Then there is also the right way to put on the mask.
Right.
So masks are meant for the sick and those taking care of the sick for now.
Any type of mask is okay?
Currently, because of the shortage, any type of mask would do.
Right.
So what we want, but also there's that regular change. Once you notice your mask is wet or moist, change your mask.
Okay.
Yeah.
We have heard different changes globally. Entertainment places have been closed down. We have functions that have been suspended. And yet we still have conversations among people who are affected directly, like in the coastal region, that they didn't have to close down entertainment places. And maybe we would just need to disinfect the areas and go on with such gatherings. How would you advise?
Well, I agree with the government,
right,
because social, you need to have that social distance. Social distancing is important in the wake of a pandemic, because we don't know, because even of the long incubation period of this
right,
virus, you don't know who has it or who doesn't. So the best thing would be for us to stay away from crowds generally. And a social gathering, a club, that's a crowd. Yeah.
All right. Well, we heard a directive or particular directives given by the World Health Organization, and the conversation about this pandemic goes on globally. You have seen pictures from across the world of areas that have been closed down. Entertainment places have been closed down. We've heard different places, the learning institutions have been closed down, and now we have empty classes. But before we take a look at that, Emmanuel Terer, what is the conversation on Twitter?
Yes, watu wanazungumza Corazon. Kuna moja nataka kuangalia, nadhani kama nimepoteza sawa, lakini quarantine, consecrate your heart first, then wash your hands and maintain social distance. Ni maoni yake at least _Nyambura. Anazungumza vile vile kuhusiana na corona, lakini vile vile Zipora Bundi at ZPZ anasema the chaos that is usually the railways bus station can't allow #COVID-19K not to spread. Those #matatu pick people while on the go, water sanitize sangapi? Ndilo swali kubwa wanauliza, kwamba wale watu ambao wanahitajika wafanye sanitation aswa katika magari ndio wanakushika kwa barabara, unapanda wakienda. So kama tunatarajia kuwepo sanitation ama kueua katika magari, itakuwa ni ngumu kidogo. So kuna mmoja hapa anasema, since we are 40 million Kenyans, government of Kenya should give each Kenyan 2 million we sort ourselves about the corona. Hiyo ndo napenda. Lakini kuna mmoja Corazon,
tujipange
anataka kusoma kitu hapa kuhusiana na tissue paper. I really love this one, ilibidi nimecheka pia. Anasema ni mtu ambaye alikuwa anauza tissue paper, anazikaisha. So anasema, due to the recent outbreak of stupidity and panic purchasing by complete idiots, the nation is currently experiencing a shortage of toilet paper and common sense.
Wow.
We expect supplies to be replenished once these ship-minded morons are all starved to death in their homes, surrounded by toilet paper but without anything to eat. Thank you for your patience. Huyo ni mtu ambaye anauza tissue. Sasa anazungumza yeye kwamba ukisikiza, ukifuata Kiingereza yake utagundua kwamba ni mtu amekasirishwa sana na jinsi ambavyo Kenya wanachukua tissue paper. Nirushe kwako moja kwa moja Corazon.
Thank you very much. Kenyans are literally taking things literally. But Brian Mima is asking a question that does coronavirus accept the gearbox of the survivors? Stay tuned. Dr. Brenda is going to be answering that question after this. Let us take a look at the directives that were given by World Health Organization officials.
Europe has now become the epicenter of the pandemic, with more reported cases and deaths than the rest of the world combined, apart from China. our message to countries continues to be, you must take a comprehensive approach. Not testing alone, not contact tracing alone, not quarantine alone, not social distancing alone. Do it all.
We can take online donations from...
Every person must know the signs and symptoms and how to protect themselves and others. Every health worker should be able to recognize this disease, provide care, and know what to do with their patients. Babies are still being born. Essential surgery is continuing. People still need emergency care after road traffic crashes. People still need treatment for cancer, diabetes, HIV, malaria, and many other diseases. And for all of this, we need health workers. Today, I want to send a personal and sincere thank you to every health worker around the world.
The purpose of social distancing is only to slightly slow down the virus so your health system can cope. The objectives are different. And I think we have to be clear that social distancing measures are not a panacea. Social distancing measures are not going to stop this epidemic. They're not going to stop this pandemic purely in their own right.
Making sure that you also practice breastfeeding. So social distancing is one aspect that we have been promoting here, but this is in addition to a lot of other measures that we have also been promoting, which include case and contact finding, aggressive case and contact finding, and testing. Testing needs to be appropriate in each country to ensure that we know who are cases and who are not cases. If you haven't been contacted as a known contact of a confirmed case, contact your local Department of Health. Contact your local ministry or your GP and say, I believe I'm a contact, what should I do?
Blanket travel measures in their own right will do nothing to protect an individual state. In fact, many countries who had outright travel bans early in this response ended up importing cases anyway and may have reacted later than they should have because they assumed travel restrictions would protect them.
Let me give you the URL while we have a few moments. It is...
Perfection is the enemy of the good when it comes to emergency management. Speed trumps perfection. And the problem in society we have at the moment is everyone is afraid of making a mistake. Everyone is afraid of the consequence of error. But the greatest error is not to move.
All right, that was a statement by the World Health Organization officials. We have Dr. Brenda here in the studio to answer your questions. Do tune in and also ask your questions on our call-in line. It's at the bottom of your screen. One of the issues mentioned there is testing. And according to World Health Organization, they're saying maybe isolation might not work on its own. But we have been asking questions if our hospitals are prepared, if we have testing mechanisms, if we would probably have officials walk into areas that have workers and have testing happen before we wait for isolation.
Well, currently we have 3 centers in the country that are doing the testing.
Mm-hmm.
Initially, we were sending our samples to South Africa for testing, but currently we have 3. I think there are 2 in Nairobi and 1 Kisumu, if I'm not wrong.
Right.
So testing, that's where all the samples are being sent.
Right.
Yeah. So it's not really feasible currently at the moment to have that people walk into somewhere and test people.
Would it be better to have testing mechanisms distributed further before we run into isolation?
Yes, testing, if we had that ability to have the testing done widely, then it would really go far in containing or rather slowing down this pandemic.
All right.
Yeah.
Well, Emmanuel Terrer has a question, but before he comes in with the question, Brian Mimmer is asking if the gearbox of the men are affected, the men who would be victims, if their gearbox would be affected. Gearbox here, quote unquote, he's talking figuratively. Would it be affected?
Currently, there are no studies that show, or there's nothing that has been mentioned on corona affecting gearboxes. So I'd confidently tell him no for now.
Right.
Yes.
Until
he doesn't need to be worried.
Until the research shows otherwise. Brian, the doctor says until the research shows otherwise, your gearbox might be safe. Emmanuel Terere, what's your question?
I guess I have the similar question.
Right.
More or less the same. Tukienda short call, we normally have the CCC kama madem tunamaliza short call unapata. Now we have to do the shaking. Are we affected in a way?
Because,
no.
Because actually, Terere, you do have a point here. They say that if you touch different openings in your body with your hands when you have the organisms, that it would cause infection.
No, it's respiratory openings or openings that lead to the respiratory tract.
Oh, okay.
Your nose, your mouth, your ears, those are openings that lead to the respiratory
So
tract.
unless Emmanuel...
So other openings don't lead there.
Unless Emmanuel and Patrick breathe through the gearbox. I think there's no need to worry here.
But they should wash their
So
hands.
that was a big one, Corazon, for me and
Right.
Patrick. For real, Patrick, man, we are not suffering in any way, so we're good.
Okay.
Before nikupatie, let me read something that someone called at Michi no Forum. I don't know if it's pronounced that way, but he's saying Corona is killing more business than people. Vile vile ya mwisho hapa. This is at MSAV. Anasema, a simple act can stop the COVID-19 spread. Wash your hands regularly. Sneeze and cough to your elbow. Alafu, I guess utafanya hivi. Get tested if you have any symptoms. Observe social distancing. I don't know, labda niulize swali moja kwa moja kwa daktari kuhusiana na hili kwamba mtu ana handkerchief au handkerchief lakini ana pia karatasi shashi au tissue lakini anataka kupiga chafya. Vipi itajika aweke hivi ndo ishe labda. Daktari.
Sijui kama ni kujibu kwa Kiswahili.
No, just say in English, it's all right. Just say in English, yes.
That's a measure. If you don't have any handkerchief or tissues in hand, then that would be appropriate because what you want to do is limit the droplets towards other people. Yeah.
All right.
So that's a good technique.
Emmanuel, are you answered?
Yes.
Okay.
Unaenda shika sasa usukani.
Good.
But this one say the psychology. I guess this inaona sana na uliuza kuhusu tissue. The psychology behind toilet paper panic ndio anataka kuelewa sana, but I guess you answered that at Orinda Hillary ndio anauliza tissue sana inafanya, lakini tayari naona umejibu hilo Corazon.
Ben Sam anauliza ni ukweli kwamba blacks hawatakuwa affected na hili sana, na anauliza pia kama hand dryers inaweza kuua viini. Can hand dryers kill the organisms in the hands?
No.
Yeah.
Hand dryers cannot kill the organisms in the hand.
Right.
The only way you'd kill the organisms in your hand is hand washing with soap and water and alcohol rubs of more than 60%.
All right.
And about those are other.
Oh, the other question: the black people.
Oh no.
Are black people more immune than white people?
Currently, we see that it's equally distributed. Everyone is being affected, black or white. Though I'd continue repeating this, that since it's a new virus, it's still under study and we can't conclude as for now.
Okay. Another question also that is there is handling of fruits, because we still have fruits in the market. And, well, if the organism is in the hand, then the fruit seller probably touched or the fruit buyer who didn't take it. And we cannot wash fruits with soap or hand sanitizers. How would you best advise concerning fruits?
Thoroughly wash them in running water.
Without soap, would that help?
You've got me off.
You know, because I know that people are on the street and are wondering, do we buy fruits or not? Especially things like apple that you have to eat using, from the skin.
But you don't have to. You can actually peel the skin.
Right.
So I guess the advice would be to peel whatever you can peel and wash. Whatever you can't peel will refrain.
Right, just leave it alone. So that simply means even the salads and everything else that we cannot boil, that the virus cannot survive under a particular level of temperature. Kwanza, what is the level of temperature beyond which it cannot survive? And does this now mean that you would deliberately advise everyone else to only interact with foods that they can boil or heat or something like that?
That's a good precautionary measure.
Right.
Because the virus can't survive beyond 40 degrees. So if you boil your food and cook your food well, because one of the preventive measures, one of the preventive measures is to cook your food properly. So you ensure you cook your food properly. Yeah.
So the ones that we cannot eat, that we can eat pre-cooked, what do we do with it? The salads, for instance. Would you advise other?
Raw salads.
No raw salads. We keep away.
If you can't wash it with soap and water, then
leave it
avoid
alone.
it.
There is a clip that went around of a person or a patient who had a swollen upper lip that had a hole, and it was claimed that that was coronavirus. Well, I know those are conversations that are going. Trust me, my inbox is full of that. So, would that be considered as some of the symptoms as well?
No.
Right.
Because it's not been reported. Under our WHO guidelines, and it's not been reported as a symptom. So if it's been seen in one person, I guess it's just that person, and I have not heard of any other cases reporting of lip swelling.
All right. Yeah. So it simply means there's a lot still that is not known concerning this virus. So it's just trial and error for now. We'll talk about vaccine. I know there's a vaccine question here as well. Naiona sijailenga, but Mary is asking about pets, handling of pets and kissing of pets, and one pet touched by 1 or 2, 3 people. What is going to happen to pets?
No, we need to limit our contact with pets. So I really don't know what we are going to do with our pets.
Right.
But limiting contact with pets is part of the social distancing and self-quarantine.
Right.
Yeah.
Limiting contact, what would that mean? Because pets are just pets, and they're petted. You know, they come to the seat, they come to your feet.
So for some time, we can't pet our pets.
For this
we
period of time.
need to love them from a distance, just the way we are doing with everyone else, our friends, our family.
All right. So no kissing pets, no shaking pets, Mary. I hope you get that. How about vaccine? There are conversations about vaccine that is from one country that's ready, that's being tested on this and that. Do you already, are we aware of any vaccine that is being processed or that is close to ready?
Actually, earlier today morning, I saw this pharmaceutical, Sanofi, that has actually come up with treatment. As far as vaccines are concerned, no, I've not heard of any vaccine that has been, which is out in trial.
Right.
But as for the treatment, I saw Sanofi has come up with some treatment, and they are beginning to roll it out or test it.
All right.
Yeah.
Somebody would say that probably, because I remember during one of the addresses by the government, they talked about treatment. They're under treatment, and somebody asked, can it be treated since it's a virus? Do we have some treatment, right?
Some viruses are treatable.
Okay.
And there are certain drugs that are under study for treatment, even chloroquine.
Right.
I've seen chloroquine in the test tube has been seen to be effective. So we are waiting for that.
We might see a return of chloroquine.
We may.
Fingers
see. Crossed.
Fingers crossed. Okay. Just before we hand over to Terera as well, there have been cases and conversations that health practitioners were not properly trained to handle this. We know that there are isolation facilities, we know that there are protective gears, but we saw Mbagathi Hospital nurses on a go-slow that they didn't receive proper training and they don't know exactly how to handle this. What is the level of training to handle this when it comes to health practitioners in the country?
Well, what the government did was you can't train everyone at a go once an emergency or pandemic occurs. But there was training for, I think they picked groups of healthcare providers, just randomly, picked. And so there are certain people who are trained.
Right.
And these people who are trained are meant to go back to their facilities and pass that training and information to other healthcare workers. But the training is still ongoing, and that's what we're doing to strengthen our capacity as healthcare workers.
All right. I understand that maybe you have to, you must probably be cautious a little when it comes to this, but would we safely and surely say that our health practitioners, even the ones who are handling the ones in isolation right now, were trained enough to handle this?
Trained enough.
Because we have seen they go slow, and one of their claims is that they did not receive any training. One would expect that if we had isolation centers and we had people who would be employed in these isolation centers, then they would have had the fast training. If you're saying that they were trained in segments, they would have had the highest level of fast training.
Well, the adequacy of training
Right.
I think is questionable.
Sure.
But training is being done.
All right.
Whether it's enough or whether we are giving that capacity to all our healthcare providers, well, it's an ongoing process.
Okay.
And Corona is a learning process. I think we are all learning as we go. Yeah. So we hope to strengthen that.
Okay. Tena wajua kila ambacho napata hapa ni kwamba ukiwa mtoto mdogo unajifunza kutembea, kisha tayari kuna moto umewashwa, kisha sasa inabidi ujifunze kutembea kwenye moto.
Ni hatari kubwa, lakini ngumu zaidi. Ukieleza hivyo ni kama niseme hivi, mtoto mdogo anayewinda paka mweusi kwenye giza totoro. Yani itakuwa ngumu zaidi kwa yule mtoto kupata kutambua paka yuko wapi kwa ni mweusi na vile vile giza totoro, ngumu zaidi. Lakini kusaidia mtazamaji kidogo kwamba kuna jinsi ya kusalimiana. Kwanza punga mkono, wave, kama utaki kutaguzana na yule binadamu mwenzako, pungie mkono, piga saluti vile vile ataelewa. Tumia kiwiko au elbow ukisalimiana naye kila mmoja, vile vile inama mbele yake labda pengine ndio aelewe. Vile vile kuunganisha mikono miwili jinsi ambavyo watu wengi wanaabudu Mungu, lakini fanya hivyo vile vile kutumia nyayo wakati wa kusalimiana, aina ya bwateke, lakini hii sijui kama itatumika sana, lakini hii njia salamu aina ya bwateke ndo labda pengine itakubaliwa. Na vile vile si kwa ubaya ukiona nimeweka mikono yangu ndani ya mfuko, si madharau, ila tunakwepa corona, ndo njia ya kusalimiana. Vile vile kuna mmoja hapa anasema jinsi ya kutengeneza hand sanitizer. Sijui daktari utasikiza hii kama ukweli. Take 100 milliliters of surgical spirit 70% and above and 2 milliliters of glycerin and mix. Services disinfectant 10 millimeters of jig regular in 5 milliliters of water. I don't know kama kuna ukweli kuchanganya 100 milliliters of surgical spirit 70% and above and 2 milliliters of glycerin and mix utapata sanitizer. Kuna ukweli daktari?
Daktari kwako.
Hiyo ni sanitizer kivyake.
Okay.
Because you have your alcohol which is 70%. Then what makes the alcohol rub is now the glycerin.
Oh.
So hiyo inaweza.
So iko sawa. Wacha nirudie sasa kwa minajili yako that kama utanga kutengeneza nyumbani, take 100 milliliters of surgical spirit that is 70% and above and 2 milliliters of glycerin and mix. Itakusaidia kama umefika katika duka la jumla na kuna sanitizer, tafadhali tumia hii kujieua mikono. Take 100 milliliters of surgical spirit 70% and above and 2 milliliters of glycerin. Corazon.
All right. Ibrahim, daktari anauliza, does ingestion of vitamins enhance your immune system? And another question, does self quarantine, does it include ventilation since it's similar to the flu? Kwa that one's na vitamins.
Yes. Vitamins, especially vitamin C, which is known to be reduce symptoms and actually help boost immunity in respiratory infection. So any flu, we advise patients to increase their vitamin C.
Intake of vitamin C.
Yeah, so oranges, citrus fruits like tangerines, lemons are good.
All right. Yeah. And wait, where was that one? Self-quarantine, does it include ventilation since it's similar to the flu?
Yes, self-quarantine, you have to have a well-ventilated room. Because if you're not having a well-ventilated room, then that means you're holding the virus hostage, whatever it is, yeah.
Okay.
Proper ventilation is
najua
important.
kuna kizungumkuti naja kwako Terena hiki kizungumkuti changu lakini daktari, as we come to the very tail end, there's a lot of panic, particularly with people who have young children in the country. There's panic that people might not get enough food. As a Kenyan, and I know you also have very possible traits of leadership, what some of the parting shots, or some of the final words you'd tell the viewer right now concerning the panic and the arrival of the virus and people assuming that it might spread wider? What are some of the things that you will tell them as you finish?
Number one is don't panic, because panic never helped anyone. If you panic, you make the right decisions. So be sane, take a breath, and just follow instructions from the government, follow instructions from healthcare providers, follow direction. If it's stay at home with your kids, stay at home. If it's social distancing, don't go to public spaces that are crowded, don't do that. So take your measures as an individual and keep yourself safe.
Okay.
Do what's within your reach to keep yourself safe.
All right. Well, as we finish, Lucy is also asking about, it's quite a long post, traveling. Like now that we only have a few testing facilities, what's going to happen to people who will be infected from Kakamega and all that? I mean, why are you people not asking for more testing facilities? Kwa nini hatujasikia wito kwamba our government should give us, the doctors, more testing facilities? What's going to happen when now we have more cases maybe from other areas of the country?
That would mean that our testing facilities would be overwhelmed. But it's our wish, even as healthcare providers, for Kenyans to be able to have that access to timely diagnosis and management.
All right.
So we hope.
Terera na jambo.
I want to ask this thing alongside the question Corazon ameuliza. Iwapo nina kirusi, tufia kwa, God forbid, it will never happen. Iwapo niko na kirusi, and then nafani kuje itest Nairobi ama sehemu umesema imetengwa, nitapanda gari, sio? Nikipanda gari kwenda kupimwa, yule mtu ambaye ndaka naye tayari ataambukizwa, itakuwaje kama ndo hitajika kubwa ndo nipate nafasi ya kupimwa bila kuambukiza mwenzangu?
So Terera, ukipatikana na, if you feel you have symptoms that align with COVID, then the next step would be for you to call. You're not even meant to take a vehicle or go anywhere. Call the hotline numbers. There are numbers provided by the government.
179?
Yes, there are those numbers that were provided in different counties. I'm seeing different numbers.
Okay.
Call the number and you'll be directed. So usually they'll direct you to a hospital close to you that will be able to handle the specimen, pick the specimen and take to the testing facility. But there's no traveling that you'll do.
All right. Yeah. Thank you very much, Dr. Brenda. Asante sana. For those who have questions, can they directly ask you questions on your social media platforms?
Yes.
All right. Where do we find you on social media?
Twitter, Dr. Achieng Ru. And I'm on Facebook, Dr. Brenda Nyariaro.
Nyariaro, okay.
Yeah.
All right. And it is definitely tagged also on our social media platforms. Emmanuel, Teresa, swali ambalo nilikuwa nalo hapa. Sasa kizungumkuti kweli. Kwamba during self-quarantine, you need to be isolated from your family members.
Yes.
At the same time, you need ventilation. At the same time, you need special utensils. At the same time, you probably need a special washroom or bathroom. At the same time, you definitely need to get out or get in at different times. I don't know. I mean,
yes, definitely.
Looking at all this, assume hii kitu imeshika mtu wa Mathare ama Ulole ama one single, bed sitter kitu kai. What's going to happen?
Ushago pia kuna lue yenye unasema iko ndani ya nyumba. So sometimes I guess
kule kuna msitu, watu wanaweza kuja.
That would be okay.
Lakini
but COVID ni kama ilikuja na starehe fulani. Like imejua na hata mtu mwenye ako na nyumba ya self contained. Buda, COVID wachana na sisi. You are also affecting people ambao hawana lugha huko ndani. So kitu kingine, achana na sisi, tunaomba Mungu achana na sisi. Ya pili ni kwamba umeuliza mtu anataka kutoka nje kidogo arudi vile vile, sawa. Ya pili ni kwamba yule mtu ambaye labda pengine nimemoa ama ni mchumba wangu, ni vigumu sana aone nikiteseka kula na vyombo vingine ya kivila na vingine. So ni kama COVID imekuja kutenganisha pia.
There's something the United Nations actually mentioned, that this is going to be worse on people who are socioeconomically challenged, you know, and it's going to be worse on developing countries, because I've seen houses that don't have windows in Nairobi here. They just have lights on the whole day, and the door is closed the whole day, and the places are already crowded. We actually are pleading with the government to make sure that it doesn't get
the government itself also need to hype uchumi wa taifa. Sasa hivi kumbaya, kungekuwa na uchumi mzuri Corazon, nadhani tungekwenda sawa. Jana ukisikiza rais wakati ule hotuba ikitolewa, unasikiza tunaweza anza kufanya kazi nyumbani, and I wonder if you don't even know that buying bundles alone ni vigumu sana. And then tutafanyaje kazi nyumbani na tuna internet? Working from home, for instance, if we're working for tele, how will you collect stories? Sometimes you have to think beyond. Someone who is working for boda atafanya kazi ndani ya nyumba. There is no internet, you can't do that. So
even on internet, you probably don't even have tarakilishi itself.
Yes,
you don't have the laptop
or
the computer.
Even the phone itself.
Or the phone, yes, or a smartphone, you know. So this is going to be hard on socioeconomically challenged or developing countries. We have Kamunge from Limuru who says, I have been reading books by Ludiam, and I find it curious that this COVID-19 is a true replica of the novel. Take, for example, the novel called The AIDS Factor. COVID-19 might have been the work of pharmaceutical companies to enrich themselves. Kumekuwa na propaganda of who started the virus and something like that. I know we only have 1 second before Mary takes us off. Sijui kama daktari anaweza sema kitu kuhusu propaganda. Daktari, before Mary gets me here running out of here. All this propaganda.
There's so much to say, especially because it's come, it's a pandemic. There are all those theories. All we can do is wait.
Yeah.
Wakuomba muombe, because God will show you.
Mungu atatufungulia. Haya, sawa basi. Maana tena kuna jambo la mwisho tukifunga.
Jinsi ambavyo huo unahubiri asubuhi Corazon, endelea kufanya vile, lakini people talk big, but have you gotten a check-up? Even if you don't show symptoms, kill the ego, get checked. There is no shame in that. That is the question I was to ask.
Because unajua HIV unaweza kutest kila mahali. Siku hizi hata kuna self-testing kits. Lakini sasa hii corona
ni ngumu kidogo. Someone said yesterday when I was reading that HIV ilipokuja tulisikika itamalizwa tu, but we are 40 years into it. Ngumu tena, so tujui, tunaomba Mungu hii imalizike kuliko tunavyosubiri. Hadi wa sasa dawa ya kukabili ukimwi bado haijapatikana Corazon.
All right, there is hope, definitely. Dr. Brenda says, Okwamba Wambe, but do remember also our president encouraged us the other day that we have faced other crises before, and we've definitely trounced all of it. We have had other pandemics, global pandemics before, and the world has already trounced all of it. So be encouraged, stay safe, take responsibility individually, and all these conversations are on our timelines. If you would wish to ask Dr. Brenda any question, then you can ask, and also you can actually refer to some of the directives that have been given. They're all on our timelines at TV47KE on Twitter and on Facebook. Today is Tuesday. We will be cooking a bit. I know the mood is not really in the kitchen, but hey, a girl's gotta eat and the boys gotta eat and the children at home have to eat. So lazima tuende kule kwenye jikoni. Naitwa Corazon Stefan.
Jina langu ni Emmanuel Terrer. Huyu jamaa anaambia wenzake turudi, tulimess katika ardhi ya Mwenyezi Mungu. That is Twitter. Tuonane katika upishe.